I share this picture with the permission of the now unfortunately deceased patient and now from his family. You're looking here at the Brown family. Ben Brown, shown at left, was a nut cancer patient who I became very close with. And while he did live much longer than the average nut patient, he eventually succumbed to the disease. And after his death, his family challenged UNC that our investigators should be trying to do something about this devastating disease, and they provided some seed funding to do so. We're working on 3 different ideas. In the interest of time and because they're not close to clinic, I won't go too deeply into the weeds, but I'll say that we are looking at 2 immunologic approaches against NUT, looking for targets either presented by the cancer cell or that are on the surface of the cell. And I mentioned earlier the extraordinary ongoing dependence of this cancer on the NUT fusion protein. Something really weird and interesting happens in the lab, which is that if you use silencing RNA, which used to be just a lab toy, against the nut, what you get are the cells either die or they turn into healthy skin, and they may even stay that way, even with drug withdrawal. Silencing RNA used to be just a lab toy. There are no cancer drugs, but there are some FDA-approved drugs for other indications, and we are working very hard on trying to bring this to clinic. I would say in parallel about our efforts as well as the efforts of others, that they are going very rapidly. In the case of our 2 leads here, quite a bit more rapidly than my most optimistic hopes at the beginning of the work. But in parallel, I would also say not nearly fast enough for patients in need. Patients with NUT carcinoma have every reason to be impatient, so do their doctors. We're moving as fast as we can, as are others, but unfortunately, none of this is in clinic or close to clinic yet. So in summary, we have NUT carcinoma. This is a rare, devastating cancer. Critical is adequate diagnosis. It should be suspected at low threshold. The testing is easy. It can be done with antibodies or molecular testing. And patients should consider clinical trials, certainly should register with the NUT registry. And while there are not great therapeutics now, I think there is legitimate hope from ongoing efforts. I promise all of us will keep working hard on this.